Welcome back to the Pharmacology 3 revision series. I hope you are all doing great. Let's dive into today's topic. Have you ever wondered, how can the same medicine save one person's life, but become a poison for another? Sounds strange, right? Well, that's exactly what toxicology explains. Today, we're going to master the complete principles of toxicology in the simplest way possible. And I promise, by the end of this video, you won't need to memorize everything. You'll actually understand it. So, grab your notebook, and let's begin. First question, what exactly is toxicology? Think for 5 seconds. Can you guess? Toxicology is the branch of science that studies the harmful effects of chemicals and drugs on living organisms. The term comes from the Greek words toxikon, meaning poison, and logos, meaning study. Simple enough. But here's something every pharmacy student should remember forever. The dose makes the poison. Let me ask you something. Can drinking water kill someone? Most people would say, no. But that's actually wrong. If someone drinks an extremely large amount of water in a very short time, it can become dangerous. Even oxygen, even vitamins, even iron tablets, can become poisonous if taken in excessive amounts. So remember this golden rule. Nothing is completely safe. Nothing is completely poisonous. Everything depends on the dose. Basic principles of toxicology. The dose makes the poison. All substances are potentially toxic. Toxicity is a function of exposure. Individual susceptibility varies. The effect of a chemical depends on its chemical nature and dose. Toxic manifestation can be prevented, reduced, or reversed. Why should pharmacy students learn toxicology? Imagine you're working in a hospital. A patient comes in after consuming pesticide. Another patient has taken too many sleeping pills. A child accidentally swallows mercury. Now think. What should the doctor do first? Should they immediately give medicines? Should they wash the stomach? Should they give oxygen? Toxicology teaches us exactly how to make these decisions. It helps determine the safety of drugs, guides poisoning treatment, supports drug development, and protects public health. Toxicity depends on the dose, duration, and route of exposure, the substance itself, and individual factors such as age and disease. Types of toxicity. Now, this is one of the most commonly asked questions. There are 3 major types: acute, subacute, and chronic toxicity. Don't worry. I'll make this so easy. Acute toxicity. Imagine someone drinks pesticide today. Within a few hours, they become unconscious. This is acute toxicity. It develops after a single large dose or multiple doses within 24 hours, and it is often severe. Subacute toxicity. Now imagine someone takes a medicine every day, for 1 month. Gradually, they start developing mild side effects. This is subacute toxicity. Repeated exposure for more than 1 day, but less than 90 days. Chronic toxicity. Now imagine exposure continues, for several months. Or even years. Slowly, the poison starts damaging organs. This is chronic toxicity. Lead poisoning is a classic example. Remember this. Acute occurs within 1 day. Subacute occurs within 90 days. Chronic occurs after more than 90 days. That's it. No confusion. Students are often confused with these 4 terms: genotoxicity, mutagenicity, carcinogenicity, and teratogenicity. Let's simplify them. Genotoxicity. Damage to DNA or chromosomes. May affect somatic cells or germ cells. DNA damage can later produce mutations or cancer. Next is carcinogenicity. Ability to produce cancer. Some carcinogens damage DNA directly. Others promote uncontrolled cell growth without directly damaging DNA. Teratogenicity. Produces birth defects. Occurs when pregnant women are exposed during organogenesis. Critical period, 3rd to 8th week of pregnancy. Effects include structural abnormalities, functional defects, or fetal death. Mutagenicity. Permanent mutation in genes. Think, genotoxicity causes DNA damage. Mutagenicity means the DNA damage becomes permanent and heritable. Easy rule, every mutagen is genotoxic. But not every genotoxic agent is mutagenic. Super easy summary. Genotoxicity DNA damage. Mutagenicity permanent mutation. Carcinogenicity cancer. Teratogenicity birth defects. Now let's learn about the general principles of poison management. Whenever poisoning occurs, doctors follow 6 important steps. Step 1. ABC. Airway. Breathing. Circulation. Life-saving always comes first. Step 2. Prevent absorption. Methods include removing contaminated clothes, skin washing, eye irrigation, activated charcoal, gastric lavage when appropriate. Step 3. Enhance elimination. Methods include forced diuresis, urine alkalization, hemodialysis, hemoperfusion, multiple dose activated charcoal. Step 4. Give an antidote. Specific whenever available and applicable. Examples: naloxone, atropine, prolidoxime. Chelating agents. Step 5. Supportive treatment. Control seizures. Treat shock. Maintain oxygenation. Correct electrolyte imbalance. Step 6. Continuous monitoring. Vitals. ECG. Blood glucose. Renal function. Liver function. Remember, early treatment saves lives. Now we study about the important poisonings that we encounter. Barbiturate poisoning. Features: CNS depression, respiratory depression, hypotension, coma. Management: airway support, activated charcoal, urine alkalization. No specific antidote. Hemodialysis in severe cases. Morphine poisoning. Symptom are classic triad, pinpoint pupils, respiratory depression, coma. Drug of choice: naloxone. Remember this, it is a frequently tested exam question. Organophosphorus poisoning. Commonly caused by pesticides. Mechanism: inhibits acetylcholinesterase, which leads to acetylcholine accumulation. This leads to sludge, which means salivation, lacrimation, urination, defecation, GI upset, emesis. Treatment: atropine plus prolidoxime, supportive oxygen therapy. Always remember, atropine dries secretions. Prolidoxime reactivates acetylcholinesterase if given early. The next important type of poisoning is heavy metal poisoning. Lead poisoning. Features: Burton's blue line, wrist drop, microcytic anemia. Treatment: succimer, which is dimercaptosuccinic acid, or calcium disodium EDTA. The next heavy metal poisoning is mercury. Features: tremors, gingivitis, excessive salivation. Treatment, dimercaprol or Succimer. Next is arsenic poisoning. Features, rice water stools, severe dehydration, shock. Treatment, dimercaprol is the drug of choice. Supportive care and dialysis when required. Remember, for all the above poisoning the management is the same. We need to follow all the 6 steps in the treatment of the poisoning. Let's do a rapid revision. Dose makes the poison. Acute 24 hours. Chronic more than 90 days. Genotoxicity DNA damage. Mutagenicity a permanent mutation. Carcinogenicity cancer. Teratogenicity birth defects. ABC is the first step in poisoning. Morphine antidote naloxone. Organophosphorus antidotes atropine and prolidoxime. Lead Succimer or EDTA. Mercury dimercaprol. Arsenic dimercaprol. If you found this video helpful, don't forget to like, share with your friends, and subscribe to PharmBuddies. Comment below on which pharmacology topic you'd like us to explain next. Thank you for watching, and I'll see you in the next video. Happy learning! All the best for your exams.